Korl.
Hey.
How are you?
Good. How are you?
I'm good, thank you. My name is Dr. Mad. I'm going to do your head to toe assessment. So you're here for a full body examination, correct?
Yes, that is correct.
Okay. Can you please verify your date of birth for me?
March 23rd, 1996.
Perfect. And do you have any allergies?
I do, yes. Bees and wasps.
Okay. And do you have any medical history that I should be aware of?
I have had a few surgeries.
Okay. And go ahead and tell me what kind of surgeries you've had.
Surgery on my leg and surgery on my chest as well.
Okay. So right or left leg?
Right leg.
Was it the knee?
Yes.
Okay. And was that after an accident?
It was, yes.
Okay. And what happened with the chest?
I just needed surgery in my shoulder area.
Okay. Also after an accident?
Yes.
Okay.
Skiing.
It is very dangerous.
It is.
All right. And when did you have this done?
This was last year.
Last year. Okay. So I'm definitely going to go ahead and check your mobility of your shoulder blades. Are you taking any medications at the moment?
I am not.
Good. And are you in any pain right now?
I am not.
Okay. Any injuries in the last 12 months?
Just the shoulder and that's it.
Okay, that's good. And any history of hypertension, hyperlipidemia, any kidney disorders?
No.
Any eye surgery?
No.
Are you wearing contacts or glasses?
I am, yes.
Contacts, okay. Okay. All right, so let's go ahead and begin. I'm going to go ahead and put this on your index finger. This will register your oxygenation and your heart rate. And then this is going to go in your ear, and I'll take your temperature. Okay, good. 98.3. Okay, now let's go ahead and check. Oxygenation is 99 percentile in room air. Heart rate is 64. That's perfect. And is it okay if I take your blood pressure on the left arm?
Yes.
All right, I'll put this on your upper arm. Okay, go ahead and relax. Perfect. So both feet are flat. Okay, put this here. Okay, good. Blood pressure is 121/65. That's perfect. Okay. And the respiratory rate is 12. That's perfect. All right, so I'm going to go ahead and check your pulses.
Okay.
All right, so this is going to go on your left wrist. Okay. 2+, and I'm going to compare on your right wrist. Okay, 2 plus and symmetric. That's perfect. Okay, and I'm going to go ahead and listen to your heart and your lungs. I want to make sure that everything sounds good. Okay, is it okay if I put this underneath your shirt?
Yes.
Okay. Sorry, I'm just going to go ahead and put it that side. All right. Okay, just breathe normal. Okay, only S1 and S2. I'm going to go ahead and just switch here, and I'll be listening for any murmurs. Okay, very good. No murmurs. All right, so I'm going to go ahead and listen to your lungs now.
Okay.
Can you please take a deep breath in? And breathe out. Good. And again, take a deep breath in. And breathe out. Good. And I'll listen to the sides as well. And exhale. Okay. And on this side as well. Take a deep breath in. And breathe out. Okay. And in the back, take a deep breath in. Good. Okay. Everything sounds very good. I could not hear any abnormal breathing sounds. Okay. Alright, so now I'm going to go ahead and check your head and your scalp. I'm looking for any lumps, any bumps, any asymmetries, and then I'll move down your neck. Is that okay?
Yes.
Alright, so go ahead and relax for me. Just going to go ahead and palpate. Good. So I'm not feeling any lumps. Head is symmetric on both sides. No pain, no tenderness upon palpation. Okay. And what I'm going to do is I'll check your scalp as well.
Okay.
Have you noticed any itchiness behind your ears?
Not currently.
Any dry patches?
Some dry patches.
Okay. And where are they located mainly? The dry patches?
On the top of my head.
On the top, okay. I'll take a look over there too. Okay. I can definitely recommend some medicated shampoos that will help to moisturize those parts. Good. Okay, everything looks good. So I'm going to go ahead and check your neck for any lymph node enlargement, all right? Okay, so very gentle palpation here. I'm not feeling any swollen lymph nodes. And also, I'll be palpating above your clavicles. Okay, good. All right, so I'm going to have you look down to your chest.
Okay.
Any pain down the spine?
A little.
Okay. Is it radiating down, all the way down to the
All the way down.
bottom? Okay, and now go ahead and Hyperextend all the way as you can. Okay. Any pain?
Slight.
Okay. Go ahead and come back. And now try to touch your right shoulder with your right ear. Okay, good. And on the other side. Okay. Okay. Well, I'm not noticing anything abnormal,
Okay.
so that's good. All right, let's go ahead and do a facial sensation test. So what I will do is I will touch you with two different textures, and I'm gonna need you to identify which object I'm touching you with, okay? This is going to feel sharp. Go ahead and extend your palm for me. I'm just gonna go ahead and show you. And this is going to feel dull. All right, so I will do that all over your face, and I'll have you close your eyes.
Okay.
All right, and tell me if it feels sharp or dull.
Dull.
Good.
Sharp.
Good.
Dull. Sharp. Dull. 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 Sharp. Dull. Sharp. 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 Dull. Dull. Sharp. Dull. Dull. Sharp.
Okay, and I'm gonna go ahead and move down your arms.
Okay.
I'm just gonna have you put your arms like this. Great.
Dull. Sharp. Sharp. Dull. Sharp. Dull. Dull. Sharp. 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 Dull. 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 Sharp. Sharp.
Okay, perfect. Okay. I'm gonna go ahead and do an arm examination. Is that okay? All right, so I'm just going to lift up the sleeve a little bit. I'm looking for any abnormal patches, any dry skin, moles. Okay. Okay, skin is dry. I'm not noticing anything abnormal.
Okay.
Okay. Okay, let's go ahead and check your eyes.
Okay.
All right, I'm gonna go ahead and check your vision now. So what I'm gonna have you do is I'll have you look straight at my nose and I'll flash a light in your eyes. It's going to be a little bit uncomfortable, but just for a few seconds. Okay, keep looking at my nose. Good. Good. So your pupils are round and reactive to light and accommodating, which is great. Now I'm gonna have you follow the light with your eyes only. Don't move your head.
Okay.
Okay, so normal eye movement. Right now I'm gonna have you cover one eye, and I need you to tell me when you see my fingers in your field of vision, okay?
Okay.
I'm going to come right here in front of you.
I see.
Good,
Yes.
good,
Mm-hmm.
good. And let's go ahead and switch eyes. Same thing, tell me when you see them.
Yes.
Good,
Yes.
good.
And yes.
Okay, perfect. Keep your eye covered, and can you please tell me how many fingers I'm holding up?
2.
Okay, try to keep your vision straight at my nose.
Okay. 1. 3. 1. 2. 2. 10. 2. 4. 4. 3.
Okay, perfect. All right, now I'm gonna have you tell me which fingers are moving, right or left, okay? So this is my right. You can say whichever, your right or my right, it doesn't matter. All right?
Left.
Okay.
Right. Both. Left. Right. Right. Left. Both. Left. Right. Left. Both. Both. Left. Left. Right.
Okay, perfect. All right, I'm gonna go ahead and check your optic nerve now. So I'll have you look straight behind me at the wall. Try to keep your eyes open, please. And I'll come very close to your eye and examine your optic nerve, okay? Okay, good. And same thing on the other side. Nerve is intact on both sides. That's perfect. Alrighty. Okay, I'm gonna go ahead and check your ears now. So I will first examine, and then I'm gonna go ahead and take a look inside the ear canal. Have you noticed anything abnormal going on? No.
No.
Alright, so what I'm gonna do is I'll slowly palpate, okay?
Okay.
Let me know if you feel any kind of pain. Okay, both ears are symmetric. I'm not noticing any lumps. Normal skin color. Okay, good. And now keep your eyes closed and tell me with which ear you hear this sound.
Left. Right. Both. Left. Left. Right. Both.
Okay, good. Okay, I'm gonna go ahead and take a look inside the ear canal. I'm gonna have you look that way for me, please. And relax. Okay. Tympanic membrane is pearl gray. No signs of any infection. No redness. Perfect. All right. Good. No signs of infection on the right side either.
Perfect.
All right. I'm gonna go ahead and check your hearing with a tuning fork.
Okay.
So I'm looking to see if there is any fluid buildup behind your eardrums. And what I'm gonna do is I'll create a vibration sound. I'll put it right here behind your ear on the masseter bone, and I'm gonna ask you to tell me when you don't hear the sound anymore.
Okay.
Okay, so can you hear it?
Yes.
What about now?
No.
Okay, let's go ahead and do that again. And you tell me when you don't feel the vibration anymore.
No.
Good.
No.
Good. And what I'm going to do now is I will put it in two different positions, and I'm going to ask you to tell me which position here is louder for you.
Okay.
So this is position 1, and this is position 2.
Position 2.
Okay? This is position 1, and this is 2.
Position 2.
Perfect. Okay. I'm going to go ahead and do a mouth exam. So what I'm going to do is I'll have you give me a big ah. And uvula's midline. I'm not noticing any lumps, no redness. Very good. All right, go ahead and move your tongue up and down for me, please. Okay, and now side to side. Very good. Can you please give me a big smile and a frown? And can you please puff your cheeks? Keep them puffed for me, please. Don't let me unpuff them. So keep them puffed. Don't let me unpuff them. Good. Go ahead and relax. All right, let's go ahead and do a neurological assessment of your face muscles. So what I'm going to have you do, I'll have you lift up your eyebrows. I'm going to try to lower them. Don't let me do that. Good. Okay. And can you please, with your tongue, stick it inside one cheek and on the other side? Okay. Now I'm going to have you look that way, and what I'm going to do is I'll push on your face, and I need you to resist that, okay? Good. And we'll do the same thing on the other side. Good. And I'm going to have you shrug your shoulders. Good. And I'm going to have you squeeze my fingers.
Okay.
A little bit harder, like you mean it. Okay. Good. Now I'm going to have you put your arms up for me. And I'm going to try to push them down. Don't let me do that. Okay. And I'm going to try to open them. And I'm going to try to lift them up. Okay. Very good. All right. I'm going to take a look inside your nose as well. And before I do that, I'm just going to make sure that both nares are patent. Okay. I'm going to close one nair. Can you please breathe in, breathe out? Good. And on the other side, breathe in, breathe out. Okay, perfect. I'm going to have you look up. Okay. No deviated septum, that's good. Okay, perfect. Okay. So what I'm going to do now is I'll check your smell. Okay. I'm going to need you to close your eyes and tell me what this smells like.
It smells like coffee.
Perfect. And I have one more.
Mint.
Okay, perfect. And what I'm going to do now is I'll check your taste. So I'll put one drop on your tongue, and I'm going to need you to identify it, okay?
Okay. Lemon.
Okay, perfect. Okay, girl, so what I'm going to do now is I'll have you face the wall, and I will do a back examination, okay? Okay, girl, so what I'm going to do is I'll slowly palpate your spine. I'm going to start with the cervical, and let me know if you feel any kind of pain. Okay. I'm looking for anything swollen. Any deviations of the spine. Okay. So I'm palpating the atlas. And moving down to C3, C4, C5. Okay. Okay, just a slight deviation of the spine. We're definitely going to need to take some measurements to see how far the curve is going.
Okay.
Okay, and I'm going to palpate the lumbar side as well. I'm not feeling any pulsations. Okay, and normal deviation of the spine on the lumbar side. I'm just noticing a slight angle here in the thoracic area. Okay. Can you please take a deep breath in and breathe out? Good. And again, take a deep breath in and breathe out. Good. One more time. Good. And again. Good. Okay. I'm going to go ahead and take some measurements of your back, and we're going to calculate the spine deviation. Okay, that's 50.2. 41. Okay. Okay. So there is a slight 3 degrees shift to the left side of the thoracic spine, and I think we're going to be able to adjust it in a chiropractic session.
Okay.
Okay. Alright, so what I'm going to do now is I will check your sensation to cold. I will touch you on different sides of your back. Can you please tell me if you feel it left or right?
Okay. Left. Right. 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 Left. Right. Left. Left. Right.
Okay, perfect. And now I'm going to check your sensations. Can you please tell me if it feels sharp or dull?
Dull. Sharp. Dull. Sharp. Sharp. Dull. Sharp. Dull. Sharp. 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 Dull. 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 Sharp. 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 sharp, sharp, sharp.
Okay, perfect. All right, I'm going to have you lay down now and I will examine your abdomen, okay? Okay, Korl, are you comfortable?
Yes.
Perfect. All right, so what I'm going to do first is I will listen to your abdomen.
Okay.
Okay, you can relax. Okay, very normal bowel sounds. And I'm going to go ahead and percuss. So it's going to feel like a tapping on your abdomen. I apologize for my cold hands. Okay, very normal sounds there. And now I'll go ahead and gently palpate. Let me know if you feel any kind of tenderness.
Okay.
Okay, and what I'm going to do now is I'll gently palpate your ovaries, okay? Let me know if you feel any kind of pain.
Okay.
Any pain as I'm pressing down?
No pain.
That's good.
Mm-hmm.
Any pain here?
No pain.
Perfect. Okay. All right, so what I'm going to do now is I'll move down to legs. Okay. Okay, so I'm going to go ahead and check your reflexes. I'm going to need you to relax your leg, okay? So fully relax. Fully relax. Good. Good. And now I'm going to go ahead and place this leg on top of the other one. Go ahead and relax. Good. And same thing on the other side. Okay, relax. Good. Okay, perfect. And same thing on the other side. Okay, good. Okay, good. All right, so I'm going to go ahead and check your babinski reflex.
Mm-hmm.
Good. Good, perfect. Okay, and I'm going to go ahead and just check your feet and take your pedal pulses.
Okay. Sorry, I know they're very cold.
They are cold, yes, which is sometimes it's normal. The blood flow to go from the extremities to the heart when you're cold, especially. All right, so 2+ symmetric, and I'm gonna go ahead and take a look in between the toes, make sure that there's no eczema, no fungal infection. Good. Capillary refill is within 2 seconds, which is normal. Means there is still very good peripheral circulation. All right, so what I'm going to have you do is I'll have you stand up and I'll take a few measurements of your entire body.
Okay.
All right, so first I'm going to go ahead and take a head circumference.
Okay.
So that's 21.3. I'm going to check both arms. Go ahead and extend your palm for me. Perfect. 70.2.5. Same thing, extend. Good, symmetric. And I'm going to take the circumference of both arms. Exactly 6.8. Perfect. Okay, I'm going to go ahead and measure your hips all the way down to your ankle. Okay, good. Okay, there it is. Good. And now I'm going to go ahead and measure your calves. Okay. Okay. 3.0. And now I'm going to go ahead and measure your waist as well. Okay. Okay, perfect. All right, I'm going to have you sit back down. Okay, so we finalized the full body examination. We were able to finish everything on time, and everything looks very healthy. Do you have any questions for me?
I don't think so.
Okay.
Just setting up the chiropractor appointment.
Perfect. We would love to make that for you happen. So let's go ahead and see when you have availability, and we'll see you back soon.
Okay. Thank you so much.
Thank you, girl. I'll see you back soon.
Thank you.